News Talk 640 WFNC. Man, oh man, time just really flies. I've got Dan Weatherly on the camera right now, and your cohort over there, Emily Beck. I've got all three of us up on the podcast right now, and you guys work at a special location here, a casino that is. No, that's not true. Dan, congratulations to you.
Thank you.
You are the newly appointed CEO of FAYETTEVILLE Health. What?
Absolutely.
And you're no stranger to that place. You've been there since 2011 or so?
Yeah, I've been there for about 15 years. I worked along with Mike Nagowski and the great team there, and really expanded the footprint of the health system over the last 15 years. So now working with a great team, and we're really just optimizing what we have and making sure people have a great experience at the health system. So very excited about the future.
Well, and Emily, what is your position, and why the heck are you here today?
Well, I have the privilege of joining Dan today as our Corporate Director for Patient Experience. I am relatively newer to Cape Fear, joined in October of 2025, and it has been a blessing to have the opportunity to partner with these teams.
Now, are you from this location or from
I am from the Fuquay area and have been very closely tied to Fayetteville with many friends and team members that I've partnered with throughout my career who have lived in Fayetteville and care very deeply about this community.
My wife is from Fuquay, so we have a house up there, so we go back and forth here. Dan, you're the man now. Dan, the man. You know, everybody said you have a pretty good sense of humor. I don't believe it.
Really? I thought this was a Barry Manilow trivia show. I'm already with Mandy and Melissa, and but we're gonna. No, I tell you, the thing for us is, you really just want to be approachable for folks, both patients and staff and each other. And we take what we do very seriously, but ourselves, we want to make sure that people feel comfortable coming to the health system or coming to one of our offices, and want to feel comfortable coming in there. It can be a scary time for people, but we want to make sure they feel welcome. So,
well, and you make a good point. The hospital is just not the hospital anymore. My kids were born there, and floors have been added. Parking deck has been added. I mean, if you're unfamiliar with the growth of Cape Fear Valley Health System, you got to be under a rock, or you must be new to this community, and that's easy to do because this is a transient community.
Sure.
There are folks who just come here, and for a little bit, and they get stationed, get sent somewhere else. I really like the new floors that you have added. They're very nice. Unfortunately, my son has been there on a couple of occasions, but I've had to come and visit him, and I said, "Man, this is nice." So after I visited him, I went downstairs and said, "Can I book this for the weekend? Because you can see the Eiffel Tower from watching out there." Well, what's the plan for the future? What do you see?
Well, as you know, we're getting ready to welcome our first medical students, our medical school students. So, part of our growth, excuse me, has been over the last 10 years especially. In 2016, we had 26 outpatient sites along with our hospital sites, and now we have over 101 different sites throughout 9 counties here. We'll see over 1 million visits this year between all of our different sites. So with the medical school, that's our brand new medical school project, and for us, we have a doctor desert here. We need physicians to be able to come and stay here, and more specialists. We started a residency program about 7 years ago, and we found that we've been able to retain 55% of all the residents that didn't go on for a fellowship that have stayed in the community because they just love it. They come in, they start a family, they live in a neighborhood, they make friends. And so that's been a really big advantage for us to be able to retain those physicians. So a medical school just takes it 4 years deeper. So now we're able to get the medical students a little earlier, and then hopefully they'll stay on for residency. But the statistics will tell you that about 65 to 70% of those students will stay and become physicians and remain in the area. So we're expecting 65 students in the month of July. Got a brand new medical school building that's right behind the hospital. We're having a public open house on June 11th. If folks would like to come out and see the new medical school, it's a beautiful site. It's, of course, in partnership with Methodist University, and we're very, very excited, very proud of what's been done here.
The interesting thing is Dr. Hershey Bell.
Yeah.
What a great character he is. Yeah, I guess that's the best way to do it. A lot of people don't know he's a musician, and he performs with folks all over the world and everything. So, and I told him that I go down to the Low Country Jazz Festival every year down in Charleston, South Carolina, and there's a Dr. Thaddeus Bell there who puts that on every year. And I've met with Dr. Bell. I said, I need to get these two Bells together. Here's people in music raising money to help scholarships for medical students. just a fantastic thing that's happening in Charleston. I sure would like to see something like that happen this way. So I threw the bug out there, and I'll be the musical coordinator to make sure it all happens. But medical school is expensive, but it's needed. You talked about the medical desert that we have here, and it's kind of a shame. We've got all the things that are happening up at Duke and in that area, but we've got a fantastic program down here with nurses and now the medical school. You've got to be excited.
No, I tell you, we have partnered with a whole lot of the higher education institutions in the area: FTCC, FSU, Methodist University, of course, Campbell University, Central Carolinas, and we often have programs that we'll partner with. For example, we partner with FTCC for larger nursing programs. We do the same with FSU with larger nursing programs. In fact, I think next fall they're almost doubling the amount of nurses that they'll have. We have 2,000 nurses at the hospital, so we have a high need. So workforce development is really important for us, and we go actually into the high schools at this point now through our recruitment efforts to get folks excited about healthcare and as a profession. And so, there's just so many great things happening for us, not only for our patients, but for our community. Being able to establish those residency programs in the medical school for physicians, you really see that pay off when you walk through the hallways and you see them 4 years ago and now they're still here as physicians. We have, some physicians that go on to fellowships and then come back. Had a general surgery resident that went on to a fellowship and came back as a cardiothoracic surgeon, so it's so great to see all that come to fruition.
The thing about Fayetteville, a lot of people don't know is I like the pace of life. I mean, if you're from the city and you're in the what I call the rat race and all the the traffic, and like I said, we've got a house up in Fuquay, and it's like it's like Charlotte Motor Speedway. Highway 55 was the only way you could get to the airport back in the day. Now you got 540 and you got 40, and so if you like the flow of what's happening in a smaller town. Fayetteville is really unique because it is a melting pot. There are people from not only all over the country, but all around the world that call Fayetteville home now. And it makes a big deal about, I think we're much more sophisticated than the folks in Wake County give us. I always pick on Wake County because I worked for WRAL. Now, Emily, you're sitting here kind of quiet, but I know you have an element that you need to talk about because there's some visitations and things have changed a little bit at the hospital.
Yes.
What's the deal now?
Well, I think you teed it up perfectly, talking about Fayetteville being this melting pot and having a unique blend of personas and people that value their support systems in different ways. And Cape Fear cares very much about being person-centric and valuing each of those individuals and what that support system looks like for each of them. And so updating our visitation policy to do just that, to include a person's family, friend, their circle that supports their health and well-being at the bedside and engaged in their care in the way that matters most to them, allows us to care for the whole person. And so we're very excited to partner with our teams across our campuses and our system to really bring that forward and focus again on what matters most to those people.
Well, that has to be a big part of healing. A lot of people don't realize just lay down and just let your body do what it has to do. That's the part of it. I mean, the start of it. And you provide an atmosphere for that to happen. Hopefully, you don't have to be hospitalized. You two guys are people I hope I never see. What do you think about it? You get what I mean. I mean,
right, we don't have double coupon Tuesday or nothing. We don't. But
you see people at their worst time.
And that's the thing. And you realize that walking through hallways, and that's why it's so important for us. I mean, one of the things that we really are concentrating on is the fact of making sure we're engaging with people when they come into the walls of the hospital. A lot of times the hallways all look the same. You can kind of get lost on where it is. We're so used to it, we go every day. But just really stopping and taking the time for people and making sure they know where they're going, if they have what they need, if they have any questions. A lot of big words can be used, and what have you there. Same for me. I mean, I ask questions all the time when I come in with the physicians. But so we just want people comfortable to come to the hospital when they need to and know that they've got someone. They know us now, and they've got someone there they know and can ask for if they have a question. I think that's really important for people to feel comfortable.
Well, I'm glad to see the continuity at the leadership position because sometimes, you go out the box and say, we'll find someone from California to come in here. You know this place.
Oh, yeah.
Back of the hand. So that's a good part. And we're sorry to see Mike go. Mike was a great guy.
Yeah.
I mean, I've interviewed him multiple occasions, and he was always very candid and transparent about whatever the issue might be,
Right.
whether long waits in the ER or whatever it might be. These are all things you got to deal with, and you can't hide them. You just have to confront them and deal with them right up front. We're going to run out of time here. Any other point you really want to drive home, Dan?
Well, just really, we're so proud of the team. You know, our Leapfrog scores just came out recently. We got 2 A's and 2 B's for our 4 hospitals that are Leapfrog hospitals, and so we're very excited about that. It's just a trajectory of where we're going moving forward, and we really appreciate you taking the time to talk to us. We want to come back. Gilbert, want to come back and talk about some more of the great things.
Well, you got to open an invitation. What we need to do is set up a time where you come at least once a month or so.
Sure.
There's or especially if you have special events, things that are going on. You know, we got this. This is not a pandemic. This hantavirus that's going on.
Yeah.
A lot of people have misinformation about what that is, and everyone's getting excited. This is not the next COVID, and we need experts talking about those type of medical things in our community. So,
well, we can get them here for you.
That's
They'll come with us, I'm sure.
all right. Dan Weatherly, Emily Beck, thank you so much for
Thank
being
you.
a part of
Thank
Good Morning
you.
Fayetteville.
Thank
You
you.
got an
Thank you.
open invitation. Come in the front door. You come in the back, we won't know you're here. All right, you're listening to News Talk 640 WFNC. We've got Fayetteville's most dependable forecast with CBS 17 meteorologist Matthew Huddleston.
Lots of sunshine once again today with a high in the lower 80s. Clouds increasing overnight as a cold front approaches from the west. A few isolated showers with it starting off the day on your Thursday in the upper 50s. That's your Fayetteville forecast. I'm CBS 17 meteorologist Matthew Huddleston.
Matthew, you're doing a great job. You deserve a raise. 50 degrees right now in Fayetteville, Hope Mills, and Fort Bragg. You're listening to News Talk 640 with WFNC.